Homelessness is a crisis affecting thousands of people in Scotland. But what's driving this growing problem? In this video, we'll take a closer look at the key causes behind homelessness in Scotland and what can be done to address it. Stay tuned. Homelessness doesn't have one simple cause. It's a complex issue that's tied to various social, economic, and personal factors. Today, we're going to explore the main reasons why so many people in Scotland are without a stable home. Number 1. Housing affordability crisis. In recent years, housing affordability has become one of the most significant drivers of homelessness in Scotland. The housing market is out of reach for many, particularly in urban areas like Glasgow and Edinburgh, where housing costs have surged. Over the past decade, average house prices and rent levels have continued to rise, while wages have not kept pace. This means that even individuals who are employed or receiving benefits are often unable to find or maintain stable housing. The scarcity of affordable housing is a central issue. In many cities, there is a shortage of both private rental properties and affordable homes within the social housing sector. New housing developments are often designed for higher-income residents, with luxury flats or homes being built for sale, further exacerbating the shortage of housing for those who are most vulnerable. As a result, a growing number of people are either forced into substandard living conditions or, in some cases, left with no choice but to live on the streets. In addition to the rising costs, long waiting lists for social housing have added to the problem. Local authorities across Scotland face overwhelming demand, with many people waiting years to be assigned a suitable home. During this time, individuals may end up in temporary accommodation, shelters, or even on the streets. The lack of affordable housing exacerbates issues such as overcrowding, which can cause severe stress and instability for families. Even for those with access to social housing, the condition of some properties can be poor, leading to difficult living situations. Structural issues, dampness, and energy inefficiency make these properties difficult to maintain and may contribute to health problems, further destabilizing the lives of tenants. Moreover, the increasing reliance on the private rental market has led to a situation where landlords, in many cases, prioritize short-term profit over the well-being of tenants, further driving up rents and leaving tenants vulnerable to eviction. Ultimately, addressing the housing affordability crisis requires a concerted effort to increase the supply of affordable homes, both in the social housing sector and the private market. By investing in affordable housing, we can help reduce homelessness rates and give people the stability they need to rebuild their lives. Number 2. Poverty and unemployment. Poverty and unemployment are two of the most pervasive causes of homelessness in Scotland. When people are struggling to make ends meet, a sudden financial shock, such as job loss or an unexpected health issue, can push them into homelessness. Scotland has experienced significant levels of poverty, with many individuals and families living paycheck to paycheck, especially in areas with limited job opportunities. The long-term effects of poverty are compounded by the nature of the job market in Scotland. Many people are employed in low-paid, insecure work with few benefits or prospects for advancement. Temporary contracts, zero-hour contracts, and part-time jobs have become more common, leaving workers with little financial security. This has led to a situation where many individuals, even though employed, are still unable to afford basic necessities, let alone stable housing. Additionally, the social welfare system, while providing essential support, often falls short in helping individuals break out of the cycle of poverty. For many, benefits are insufficient to cover the rising cost of living, and the application process for support can be lengthy and confusing. Those in need of housing assistance often face long waiting times for social housing, while others rely on temporary accommodations that are ill-suited for long-term living. Unemployment also plays a significant role in homelessness. In Scotland, some regions are plagued by high unemployment rates, particularly in areas that have historically relied on industries such as manufacturing or coal mining, which have declined in recent decades. For people living in these areas, finding stable, well-paid work can be a difficult and often fruitless process. This lack of opportunity creates a vicious cycle, as unemployment leads to further financial hardship, which in turn makes it more difficult to find and maintain housing. The combination of low wages, high unemployment, and a broken social support system makes it incredibly difficult for individuals to escape poverty. Without sufficient income or employment opportunities, many people face housing instability and eventually homelessness. To tackle this issue, a multifaceted approach is required, including increasing wages, creating better job opportunities, and ensuring that the welfare system supports people effectively. Number 3. Mental health issues and addiction. Mental health issues and addiction are among the most common contributing factors to homelessness in Scotland. Studies have shown that a significant proportion of homeless individuals in the country suffer from mental health conditions or substance abuse disorders. For many, homelessness is not just a result of financial hardship, but also a consequence of untreated mental illness or addiction problems. Mental health problems such as depression, anxiety, PTSD, and schizophrenia can make it incredibly difficult for individuals to maintain stable housing. Mental illness can impair a person's ability to hold down a job, manage finances, or maintain relationships, all of which are crucial for securing and keeping a home. As a result, individuals with mental health conditions are disproportionately affected by homelessness. Addiction to drugs or alcohol is another significant factor contributing to homelessness in Scotland. Individuals struggling with substance abuse may find themselves unable to keep a job, leading to financial instability. Moreover, addiction can cause people to become socially isolated, losing family support or falling out of touch with friends. As their lives spiral out of control, their ability to maintain housing becomes increasingly difficult. In some cases, addiction leads to eviction or the inability to pay rent, pushing people further into homelessness. The stigma surrounding mental health and addiction can also prevent individuals from seeking the help they need. Many people experiencing homelessness avoid seeking support because they fear being judged or misunderstood. This can result in individuals suffering in silence, trapped in a cycle of homelessness and untreated illness. To address these issues, it is crucial to integrate mental health and addiction services with homelessness support. Providing accessible mental health care, addiction recovery programs, and social support systems can help individuals recover from these conditions and regain stability. By offering specialized support for those with mental health or addiction issues, we can prevent them from becoming trapped in the cycle of homelessness. Number 4. Family breakdown and domestic violence. Family breakdown and domestic violence are leading causes of homelessness, particularly among women and children. In Scotland, domestic abuse is a significant factor contributing to homelessness, with many victims fleeing abusive situations without anywhere to go. When faced with violence at home, people often find themselves with no choice but to leave, sometimes with little more than the clothes on their backs. The impact of domestic violence on homelessness is profound. Women, in particular, are at high risk of becoming homeless due to domestic abuse. The emotional and physical toll of living in an abusive relationship often leads to long-term trauma, making it difficult for survivors to maintain stable housing. Many women fleeing domestic violence are forced into emergency accommodation or temporary shelters, which can be inadequate and unsustainable for long-term living. In some cases, children also become homeless due to family breakdown. The trauma of experiencing or witnessing violence can have long-lasting effects on children, including emotional distress and developmental challenges. The lack of suitable housing for these families can make the situation even more difficult, as temporary accommodations often fail to meet the needs of women and children who are escaping abuse. In response, Scotland has established laws and policies aimed at helping those fleeing domestic violence, such as the Domestic Abuse Scotland Act 2018. However, challenges remain, particularly in terms of ensuring adequate support services for survivors. More dedicated resources are needed to provide safe, long-term accommodation for women and children fleeing violence, as well as greater support for those who have experienced family breakdowns. Number 5. Government policy and social services. While Scotland has made strides in addressing homelessness, government policies and the provision of social services remain crucial in tackling the root causes of homelessness. The Scottish government has introduced several measures over the years, including the Homelessness Scotland Act 2003, which aims to ensure that anyone who is homeless or threatened with homelessness has the right to support and accommodation. Despite these efforts, gaps remain in the support system that prevent many individuals from escaping homelessness. One significant issue is the lack of affordable housing available through local authorities. Although the government has made efforts to increase the supply of affordable housing, demand continues to outstrip supply. Long waiting lists for social housing and a shortage of temporary accommodation contribute to the growing homelessness problem. Furthermore, the cuts to welfare benefits and the introduction of the bedroom tax have disproportionately affected those at risk of homelessness. For many people, these cuts have made it even harder to afford rent and other living costs, pushing them closer to homelessness. The reduction in housing benefit, in particular, has had a direct impact on those living in private rentals, making it difficult for people to stay in their homes. Social services are another critical component in tackling homelessness. However, the system is often overstretched, with long waiting times for support services and limited availability of emergency accommodation. For those who require ongoing support for mental health issues, addiction, or family breakdown, the lack of comprehensive, coordinated services can delay or prevent recovery, making it even harder to secure permanent housing. To effectively combat homelessness, a more integrated and holistic approach is needed. This includes providing not only emergency accommodation, but also long-term solutions, such as affordable housing, mental health and addiction services, and welfare support. By addressing these systemic issues, Scotland can work toward ending homelessness for good. Number 6. Rough sleeping and emergency accommodation shortages. While rough sleeping is the most visible form of homelessness, it is often the result of broader systemic issues, including housing affordability, poverty, and a lack of support services. Scotland has made progress in reducing rough sleeping over the years, but the issue remains a significant concern, particularly during winter months when demand for emergency accommodation peaks. Rough sleepers are among the most vulnerable members of society, facing exposure to the elements, violence, and poor health. Unfortunately, many of those who end up sleeping rough are unable to access adequate emergency accommodation due to overcrowding, long waiting times, or a lack of space in shelters. As a result, they are left to fend for themselves on the streets. One major challenge is the shortage of emergency accommodation. Shelters are often overburdened, particularly in urban areas, and may not be suitable for individuals with specific needs, such as those with mental health issues or addiction. The lack of available spaces in shelters leads to a situation where some individuals are forced to sleep rough, compounding the risk factors that contribute to homelessness. Furthermore, rough sleepers are often excluded from mainstream services due to mental health, addiction, or behavioral issues. This means they may not be able to access the necessary support for housing, health, or social integration. To reduce rough sleeping, Scotland needs to invest in more emergency accommodation spaces, as well as create more permanent housing solutions for people at risk of becoming homeless. This requires significant investment in both short-term and long-term resources, including accessible shelter spaces, outreach programs, and social support.